welcome to the channel Dewdear Academy. In this video I have included the topic dehydration in children. So today I am discussing dehydration in children. If you have not subscribed to the channel, please subscribe it. Also you can download the app Dewdear Academy from the Play Store and you can do the practice questions. So the topic is dehydration in children. What is dehydration? It is a common fluid and electrolyte imbalance in infants and children. It is a common fluid and electrolyte imbalance in infants and children. And the organs that conserve water are immature and that place the children at risk for fluid volume deficit. The organs that conserve the water are immature. Also, infants and children are more vulnerable to fluid volume deficit because more of their body water is in the extracellular fluid compartment. So this is dehydration, and the important causes of dehydration include decreased fluid intake, then diaphoresis, vomiting, diarrhea, diabetic ketoacidosis, extensive burns or other serious injuries. So these are the causes of dehydration, mainly decreased fluid intake, then diaphoresis or sweating, then vomiting, diarrhea, diabetic ketoacidosis, extensive burns and other serious injuries. Next is the assessment of dehydration. So the dehydration, it can be divided into three levels, that is mild, moderate and severe. Based on the clinical signs, the dehydration can be divided into three categories, that is mild, moderate and severe. So first is based on the weight loss. Weight loss in infants we can classify, that is if the weight loss is 3 to 5%, it can be mild dehydration. For the infants, if the weight loss is 3 to 5%, it is for infants, if the weight loss is 3 to 5%, it is known as mild dehydration. And if it is 6 to 9%, that is known as the moderate dehydration. And for if it is greater than 10%, that is known as the severe dehydration in infants. If it is greater than 10%, that is known as the severe dehydration. Severe dehydration in infants. Also for children, weight loss, if it is 3 to 4% weight loss, then that is considered as mild dehydration in children. 6 to 8% it is moderate dehydration in children, and if it is 10% it is severe dehydration. Then for the mild dehydration, the pulse will be normal. Pulse is normal. Then it will be slightly increased in moderate dehydration and it will be very much increased in severe dehydration. Again, the respiratory rate, that will be normal in mild dehydration. Then there will be slight tachypnea. Rapid and slight tachypnea is found in moderate dehydration, and hyperapnea is found in severe dehydration. Hyperapnea is found in severe dehydration. Then regarding the blood pressure, it is normal for mild dehydration, normal to orthostatic in moderate dehydration, and orthostatic to shock may occur in severe dehydration. Orthostatic to shock in severe dehydration. The next is behavior. It is normal in mild dehydration, and the baby or the infant will be irritable and more thirsty in moderate, and hyper irritable to lethargic in severe. Hyper irritable to lethargic in severe dehydration. Then next is regarding the thirst. There will be slight thirst. Patient or baby will be having slight thirst in mild dehydration, moderate thirst in moderate dehydration, and there will be intense thirst in severe dehydration. Then regarding this mucous membranes, it is considered as normal. Mucous membranes are normal. In mild, it will be dry in moderate, and it will be parched in severe dehydration. Then the tears will be present in mild dehydration. Regarding this tears, it is present in mild dehydration. It is decreased in moderate, and it is absent, and sunken eyes are found in severe dehydration. Next is regarding this anterior fontanelles. Anterior fontanelles are normal. Anterior fontanelles are normal. In mild dehydration, it is normal to sunken in moderate, and it will be in severe dehydration, it will be found as sunken. Anterior fontanelles are sunken. Next is regarding this external jugular vein. It is visible when supine. External jugular vein is visible when supine. It is not visible except with supraclavicular pressure. In case of moderate dehydration, it is not visible except with supraclavicular pressure. Then it is not visible even with supraclavicular pressure is found. That is in severe dehydration. The external jugular vein is not visible even with supraclavicular pressure. Next is regarding the skin. The skin capillary refill is greater than 2 seconds for mild dehydration. But in moderate dehydration, this capillary refill is slowed. That is 2 to 4 seconds. Also, there will be decreased turgor. So, the capillary refill time is slowed with 2 to 4 seconds in moderate dehydration. And in severe dehydration, it is very much delayed. Very delayed, that is greater than 4 seconds. And also, there will be this skin will be cool, acrocyanotic or mottled. The skin is cool, acrocyanotic and mottled. Then regarding this urine specific gravity. Urine specific gravity, it is greater than 1.020. It is greater than 1.020 in mild dehydration. And in moderate dehydration, it will be greater than 1.020 with oliguria. And in severe dehydration also we can see oliguria, or it may goes to anuria. So these are the important clinical signs in dehydration. We can classify it into mild, moderate and severe based on these clinical signs. Next, I am discussing the interventions or management. So first and most important thing is treat and eliminate the cause of dehydration. Then monitor the vital signs. Monitor weight and also the changes. Monitor for the changes that include this fluid gain and loss. Then monitor the intake and output and urine for specific gravity. Also monitor the level of consciousness. Then monitor the skin turgor and mucous membrane for dryness. So these are all the important interventions or management. We have to identify the cause and also check the vital signs, weight, then intake output, level of consciousness, then skin turgor and mucous membrane. Then next is the interventions, that is or management for mild to moderate dehydration. So for that, provide the oral rehydration therapy with rehydration solution as prescribed. So most important thing is provide the oral rehydration therapy for mild to moderate dehydration. And also avoid carbonated beverages because they are gas producing. So ORT, oral rehydration therapy, should be given and avoid carbonated beverages. Then for severe dehydration, the interventions include maintain NPO. NPO is nothing by mouth. So maintain the NPO status to place the bowel at rest and provide the fluid and electrolyte replacement by IV route, by intravenous route as prescribed. So for severe dehydration, the electrolytes are replaced by intravenous route and keep the patient NPO. If potassium is prescribed for IV administration, ensure that the child has voided before administering and has adequate renal function. So if potassium is prescribed as IV administration, we should ensure that the child has voided before administering and also the child has adequate renal function. Then reintroduce a normal diet when rehydration is achieved. Provide instructions to the parents about the types and amount of fluid to encourage, and also signs of dehydration and the indications of the need to notify the healthcare provider. So we have to give the instructions to the parents regarding the type of fluid given and what are the signs of dehydration to be noted, and also if there is any problems, what are the indications of the need for notifying the healthcare provider. This should also be informed to the parents. So thank you for watching this video. Also, you can download the app Dewdear Academy from the Play Store, and you can do the different practice workout questions, and the sample papers of the previous year question papers are available. So thank you.